Hi guys, welcome to another episode of Learning Polycystic Ovary. I will be listing out the major supplements that helps in improving omega H3, vitamin D3, K2. If you have a pen, just grab your pen now and start writing down these supplements and proper management of polycystic ovary. In this video, I will list out all the supplements that worked for me and I believe is working for many other people. But before you take any medication, always try to consult your OB/GYN, which is obstetric and gynecologist, before you start your medication, because their body, the way at which our body responds to medication is different. So that once you start having any other sign and symptoms or side effects, you will consult your doctor and he or she is going to change your supplement for you, and your doctor is going to advise you on what to do, whether to continue or discontinue your medication. So today in my video, I'll be talking about major supplements that helps in improving PCOS. We have omega H3. Omega H3 comes in 500 milligram and 1000 milligram. After listing this supplement, I'm going to mention what the function it does in the body. We have omega H3. It comes in 500 milligram, 750 milligram, and 1000 milligram. I personally use 1000 milligram. This omega H3, what it does in the body, it helps to prevent inflammation. Maybe you will have a lot of bloating after eating. You're always bloating. It helps in improving that, so you will no longer bloat again. Then secondly, brain development, very good. And another thing it does, it helps to glow your skin. When you start taking omega H3, your skin will be glowing. In fact, many people will start asking you, what are you taking? What are you using for your skin? It's very, very good in glowing your skin as well. So I'm going to show you the picture of how omega H3 look like. Mind you, uh, omega H3 comes in different brand. You may find another brand that does not look like mine. It's not necessarily you get the same brand with mine. You can get another brand that has the same milligram. Okay, so this is what we call omega H3 fish oil. My Naija people they call am fish oil. This is omega H3. We have omega H3. Omega comes in different form. We have H3, H6, H9. There are other omega that combines the three together, but PCOS is omega H3 is very effective in polycystic ovary. Yeah, this is omega H3, 1000 milligram. What you do is you take one of this soft gel daily. This is how it looks like. One soft gel daily. Daily. Vitamin D3 K2. Vitamin D3 K2. I mentioned Myo inositol earlier. Myo inositol with D-chiro or Myo inositol. You can't take the two together. You rather take one in between the Myo inositol or Myo inositol with D-chiro. Then we have vitamin D3 K2. We have vitamin E, which is preferably, I would say 1000 in international units, but if you don't get it, you can still use 800 IU. Okay, if you are going to use a 400 IU, you're going to take two, but 800 IU, advisably, you take one. This D3K2 comes in, the D3 comes in 500 IU, the K2 comes in 200 milligram mcg. Okay, N-Acetyl L-cysteine. This is what we call NAC NAC. NAC is very, very good supplement in improving polycystic ovary. It comes in 600 milligram or 1000 milligram. If you're gonna take 600 milligram, maybe you should take. To me, when I'm closer, because the medication is not much and I usually order online. So if you are going to take this NAC, preferably you will take two dose morning and night. That's because it is 600 milligram. While some doctor will tell you to take it 3 times daily, depending on how worsen or how your PCOS is. If you are 40 years and above, you shouldn't be going for a lower dose. You should be going for a higher dose. Okay, that is 1000 milligram of this a day, or you should take 600 milligram 3 times daily if you are 40 years and above. If you are 40 years and above and your egg quality is very low, this Myo inositol you should be taking 200 milligram 2 times daily or 3 times daily, but make sure you consult your doctor before starting. But if you are less than 30, just start with 200 milligram. It's okay for your egg quality. Okay. Um, this is vitamin C. Don't take excess vitamin C. It can dry up your cervical mucus. Vitamin C, 1000 milligram. Don't exceed the dose of 1000 milligram daily. Vitamin C. You pick out one from this and dilute it in the water and drink it. Drink one daily for at least 1 month. After 1 month, I will advise you not to continue with vitamin C because it will dry up your cervical mucus. And you know when your cervical mucus is dry, what it means. Don't take too much. Don't take excess of this. So this is what we call ubiquinol. Um, I took this Ubiquinol has like 3 different. The general name is called CQ10. You see, it's coenzyme Q10. This is it, CQ10, coenzyme Q10. This is the best one, the best CQ10 for conceiving. This is the best CQ10 for conceiving. It helps in improving ovulation. Very good in improving ovulation. If you're a woman that you don't used to ovulate and your cervical mucus is not coming out during ovulation, you no longer have sign of ovulation again. You don't have ovulation discharge. Once you start taking this ubiquinol, just look at the spelling correctly. You have Ubiquinol, ubiquinol. I took coenzyme Q10 that have ubiquinol, the one that's ending with NONE, but it doesn't work for me because I started having tightness of chest, or I was breathing heavily because it's only meant that one was meant for in heart health, and this one it helps in improving fertility. This one that helps in improving fertility, it comes in 100 milligram, 200 milligram, even 400 milligram. That is a higher dose. If you are 40 years and above, you shouldn't go for a lower dose. Advisably, you will start when you start with lower dose and you are not seeing the improvement in your egg quality, maybe during the scan, you should go for 400 milligram. That is two soft gel daily. This particular one, once you start taking it, you start seeing a discharge like okra. In another video, I'm going to teach you the different color of discharge and what it means in fertility. Okay, this ubiquinol helps in improving egg quality. It helps in improving ovulation, and it helps TTC moms. Okay, very good for PCOS. Even though you don't have PCOS and you're trying to conceive, I'm going to recommend this ubiquinol for you. In my next video, I'm going to show you 2 different ubiquinol that's I know they are even 3 different. I'm going to show you in my next vlog. Out coenzyme Q10. These two are coenzyme Q10. They have difference. They did not work the same way. This is for heart health. The other one is for fertility. So this does not work for some people trying to conceive, while some it works for them. But for me, I had tightness in chest. I was breathing heavily when I was taking this. So I consulted my doctor and I stopped this. So my doctor recommended ubiquinol for me. Okay. So magnesium. The best magnesium you should use if you have PCOS is magnesium glycinate. Okay. Magnesium glycinate comes in 500 milligram or 1000 milligram, 100 milligram, 200 milligram, depending on the company you get. But I am using 300 milligram. If you have PCOS, you know that we have problems of sleeping. We don't sleep, or we don't usually find it easy to sleep because our cortisol level is very high. When you have PCOS, your cortisol level is high, and for that reason, you will not be able to sleep on your own except the use of medication that reduce your stress hormone, which is magnesium, not sleeping pills. This is magnesium. What magnesium does, it helps to reduce the stress in the body, relax your muscles, and it will make you to sleep better. So I've used magnesium before, but ordinary magnesium, but it was not working well for me, so I changed to magnesium glycinate to relax my muscle, improve insulin sensitivity, and it improve cortisol level and helps me sleep well. These supplements might have another name, but somebody bought it for me. It's called Motovati. Motovati plus contain L-carnintine. You know what L-carnintine means? L-carnitine, it helps in reducing BMI. This supplement contains levocarnitine tartrate. It contains acetyl levocarnitine hydrochloride. So this supplement, what it does, it helps to reduce your weight, in weight management. Maybe you're having problem in losing weight. It's very good. It works for losing weight and losing BMI. It helps to improve weight loss management in PCOS. And this ferroglobin, this is ferroglobin. The reason why I would advise you can go for ferroglobin, and if you like, you might not go for it. If you have supplement that have folic acid, you don't need to go for ferroglobin. But if you don't have supplement um that has zinc, folic acid, this ferroglobin contains many supplements. It contains zinc, it contains copper, it contains iron, it contains iron and B12, B6, B1 and iodine. I think it's very, very good in improving PCOS. And iron is very good, very, very good in improving PCOS. But before you go for all these vitamins, make sure you do a blood work test that shows the level of your vitamin in your body, and your doctor will tell you which vitamin to go for and which one you should avoid taking to prevent using excess medication. Go for blood tests to know the level of your vitamins and what vitamins you needed in your body. Okay, this is a progesterone medication. It's pills. If you know you have a low progesterone and your doctor is suggesting you should use pills, your doctors know better why he or she is telling you to use pills. If your doctor is insisting you should use it, just use it for better results. But if you're having your period and you want a normal period, you don't need to stress yourself and go for Dufaston. Dufaston is what it does. It makes your it will it's a pill. It's a progesterone pill that works. It will go and mimic your body as if your body is ready to prepare for period. It will mimic this your body and it will help in improving your blood flow. If you're having a regular period, it will make your period to come. But honestly, I will not advise you to be going for pills because once you take pills and you don't take it again, your period will no longer come. It only comes once you take it. You take it for two, 21 days. If you take the medication after taking it, before you know, after 4 days or 7 days, your period will start flowing. So, but any month you don't take this medication, it will not come. So, preferably, why not you should go for this to regulate your period rather than going for this. Okay. But metformin. I've talked about metformin in my previous video. Metformin is very good in metformin is very, very good in insulin resistance. Very good in improving insulin resistance. It balances your hormone. But honestly speaking, let's be candid. Metformin, metformin in particularly makes your body very weak, very, very weak. If you are taking metformin, let us know in the comment section. Metformin, after taking metformin, you will have polycystic ovary. You will be so tired, you will feel fatigue and depression. As in, your body will be so weak to do all the work. You know what I mean by that. So, metformin is good, but advisably, if you are going for metformin, I will advise you to have this supplement, L-carnintine. It, it comes in powder form, it comes in tablets. So, you take it in the morning. This one will give you more energy. More energy. Any supplement that have L-carnitine, it gives you more energy. When you take it in the morning, you have more energy. So preferably after taking this supplement, whenever you're taking it, you take it 2 hours before food. 2 hours, yes. After taking it, after taking this medication, you have to wait for like an hour or 2 hours before eating. So 2 hours before food. So if you take this, you will have more energy. You will not feel fatigue and tiredness again. But if you are taking this, you feel tired. But it works better. Honestly, it works better. In fact, many doctors will advise you to go for metformin, but not every woman can take it. Honestly, if you're taking metformin, you will be so weak. Thank you for watching my video. See you in my next vlog. Bye.